right. Well, I would love to welcome everyone today. Thank you for taking the time to join us this Wednesday afternoon. My name is Katie Junk with Ochsner Digital Medicine, and I will be helping support today's webinar. Today's presentation features Aya Hines, Ochsner Digital Medicine Senior Clinical Pharmacist. Aya received her Doctor of Pharmacy degree from the University of Arizona College of Pharmacy and is board certified in ambulatory care. She specializes in managing chronic conditions and optimizing medication therapy to improve patient outcomes. And then I'll also be popping in at the end to share more about Ochsner's digital medicine program. So a few housekeeping items before we get started. We will have a Q&A, as I mentioned before, at the end of the presentation. So please feel free to put your questions in the Q&A function that is located at the bottom of your screen. And we will answer those at the end of the presentation. The webinar is also being recorded today, so if you registered for today's webinar, you will receive a link to the recording that you can watch on demand on your own time. So February is American Heart Month, and it's a time when we bring awareness about heart disease and what you can do to improve your own heart health. So today our expert speaker, Aya, will share practical tips that will help you care for your heart and live a longer, healthier life. We're also going to discover strategies for heart health, including diet, exercise, stress management, and insights into heart disease risk factors like blood pressure, cholesterol, and weight. Plus, we're going to gain valuable knowledge on prevention and the latest research in heart health. And then to wrap things up, we're going to hear about digital medicine. This is a program that's offered by Ochsner that's helped thousands of members achieve their blood pressure, diabetes, cholesterol, and healthy weight goals, helping these patients control their health and reduce the long-term complications of heart disease. So without further ado, I will pass it off to Aya to get us started. Thanks, everyone.
Perfect. Thank you so much, Katie, for that introduction. I am so excited to be here today during Heart Month to speak about this topic. It's near and dear to me, and I'm sure many people on the call today. Thank you for joining, and I look forward to any questions that you may have. Please pop those in the chat. But we'll go ahead and get started. The objectives for this presentation today are to explain heart disease as well as risk factors, to understand ways to prevent heart disease and keep your heart functioning well. And then lastly, as Katie said, we'll talk about digital medicine and how it can help you manage your heart health. So cardiovascular health refers to how well your heart and blood vessels are working. This is central to your overall health. And heart healthy living involves understanding your risk and making healthy choices, as well as taking steps to reduce your chances of getting heart disease. Heart disease is the leading cause of death for men among most racial and ethnic groups in the United States. And this is really for several reasons, many of which are linked to lifestyle choices as well as genetic factors. Men tend to have higher rates of smoking and alcohol consumption, and there are hormonal differences here as well. Testosterone, while it's important for health, has been linked to increasing the risk for heart disease in certain cases. Unfortunately, half of the men who die suddenly of heart disease had no previous symptoms. So I just want to let that sink in. They had no previous symptoms. So even if you have no symptoms, you may still be at risk for heart disease. And this is why it is important to understand if you are at risk and what you can do about it. Generally, women have a lower risk of heart disease due to the protective effects of estrogen. However, heart disease is still the #1 cause of death in women in the United States. Unfortunately, women's awareness of this has declined over the last decade. There was a study that was done by the University of Missouri, and this showed that many people believed that breast cancer was the most common killer of women. However, cardiovascular disease actually kills more women than all forms of cancer combined. Furthermore, heart disease and stroke can affect women at any age, and this makes it vital for all women to understand their personal risk factors and family history. Life events such as pregnancy and menopause also affect the risk. After menopause, heart disease risk rises significantly, and it can reach similar levels as men. There are various risk factors for developing heart disease, and chances are you or someone you know has a condition or behavior that increases the risk. Some of these risk factors, though, are modifiable, which means that you can do something about it. You can change your risk, while some of these are non modifiable, which you cannot change about yourself. So, things like genetics, your family history of certain conditions can increase your risk of heart disease. Age, because risk increases with age. Race, the risk for heart disease varies by race, and Black, Indigenous, and people of color are at greater risk for complications to heart disease. Heart disease greatly affects both men and women, as we've talked about. However, men are at a greater risk for heart disease at a younger age. And then the key risk factors that are highlighted here on the slide are the conditions and behaviors that most affect the risk. So, high blood pressure, high cholesterol, and smoking status. Half of Americans have at least one of these things. The term heart disease, though, is an umbrella term, and this refers to any disease of the heart. The most common type of heart disease is called coronary artery disease. It's also known as coronary heart disease or ischemic heart disease. The image on the right shows a heart as well as a cross section of two arteries. And in the normal healthy artery, which is on the top, there is no or minimal plaque buildup. However, as you grow older, cholesterol deposits form a buildup of plaque in the arteries. As you can see on the bottom, that's the yellow area that you can see. And this leads to a narrowing of the artery and reduced flow of blood to the heart. This reduced blood flow can cause a heart attack, can also cause a stroke. Plaques can also rupture or break off, break loose, and cause a blood clot. The good news is that most heart disease is preventable, and getting regular health checkups can prevent or catch heart disease early for you. The American Heart Association lists 8 key measures to improve cardiovascular health. And better cardiovascular health helps to lower the risk for heart disease, stroke, and other major health complications. This list is comprised of 2 major areas, so the health behaviors and then the health factors. The behaviors are things like eating better, being more active, quitting tobacco, and sleeping well. The health factors are managing your weight, controlling your cholesterol, managing your blood sugar and blood pressure. So, as you can see, it's important to know your blood pressure, your blood sugar, and cholesterol numbers, which digital medicine is very well suited to help you through this. And we'll talk about this more later on in the presentation. I did just also want to point out here that food and exercise are medicine. It's important to improve your diet and physical activity because it's fundamentally important in prevention and in the management of heart disease as well, either on their own or in combination with medication. So even if you're on medicine for these things, diet and exercise can further help you. For a lot of people, going on a diet can seem daunting or confusing. And so I just wanted to introduce this idea of the eating plan called DASH. Use this as a guideline or principles to implement a healthy diet that you enjoy following. And the key word here is enjoy. You want to do something that you like eating. You want to eat things that you like eating because it's going to be something that you can sustain long term. And the DASH diet is very well referenced online. And so, if after this presentation you can't remember what we talked about, just Google it. There's a lot of great resources out there. A lot of my patients, they'll ask me, Aya, what can I eat? What food should I start eating to help me improve my heart health? And unfortunately, I don't have an answer for this. There's not one food that you can start eating that's going to improve your health, unfortunately. However, fruits and vegetables, whole grains, whole wheat bread, fat-free or low-fat dairy products, fish, beans, nuts, these are all very healthy foods for you, and hopefully you can start incorporating these into your diet. We also want to limit foods that are high in saturated fat, such as fatty red meat, full fat dairy products, and then limit the sugar sweetened beverages and sweets, and then as well as alcohol. This may be more fiber than your body is used to. When you look at this slide, a lot of these foods are higher in fiber. And so initially, if you were to start all at once, this can cause a lot of bloating and stomach upset. And so to avoid these problems, I recommended to my patients to gradually increase the amount of fruit, vegetables, and whole grains that you eat over several weeks. And because these dietary changes really can lead to significant improvements in your health, if you're taking cholesterol medication or blood pressure medicine, it's very important to let your doctor know so that your conditions can be monitored appropriately. And the big thing I want you to see here is that the DASH diet can reduce your blood pressure by as much as 11 points in some patients, especially when combined with diet and exercise. And this is really as much as a medication can do. And so this just really highlights how exercise and food is medicine. Most doctors will tell you to eat less salt, but what's so bad about sodium? Sodium is the chemical name for salt. It causes your body to hold on to water, which can in turn increase the blood pressure and put strain on your kidneys, arteries, heart, and brain. This is why we need to pay attention to how much salt we consume. Learning how to read and understand food labels can really help you make healthier food choices. Let's say you're at the grocery store and you have more than one food choice. Compare the nutrition facts. Choose products that have lower amounts of sodium and also pay attention to things like serving sizes, which is at the top of the food label, and then also things like sugar and added fats. Especially pay attention to the nutrition facts when you're looking at foods like deli meat, canned food, frozen meals, because salt can hide in these foods. Even if the food is not inherently salty, because salt is a preservative, it can still have a high amount of salt. And so you may ask me how much sodium per day is healthy. And the answer is it depends. And so really, if you want to know what it is specific for you, talk to your health provider because it's based on certain medical conditions. Unfortunately, most people eat too much salt without even thinking about it. The average American eats about 3,400 milligrams of sodium per day. That is way more than the American Heart Association recommends, which is about 2,300 milligrams of salt per day. If you have high blood pressure, though, the goal is to consume no more than 1,500. And so, one thing I want to highlight here is the goal is not to get to zero. The goal is to really control the amount that you're consuming, reduce it if you're consuming too much. And so the best way that I like to get started with this is to first start tracking how much you are currently consuming. Do it for a week. You can use resources out there like apps that can help you to track how much salt is in your diet currently. MyFitnessPal is one that I've heard from patients that they've used and had success with. And just start by cutting it back, reducing your amount of salt that you have each day. A good rule of thumb as well is that foods that have 140 milligrams of sodium per day are considered low in sodium. I'm sorry, per serving. So, as I've said before, exercise is great for your health. It can help you feel, think, and sleep better. It is vital for healthy aging, and active people generally live longer and are at a lower risk for serious health problems like heart disease, type 2 diabetes, obesity, and cancers. Exercise can also help to improve your heart health, including lowering your cholesterol. And so, if you're moving your body, I say it counts. If you're parking farther away from the grocery store, walking your dog, getting an extra hour at the gym, all of that will count. The most important thing is that you're moving your body. Try to get at least 150 minutes per week. That's about 30 minutes, 5 days a week. And if you're already there, wonderful. Try to increase the intensity or incorporating more strength training, balance training, or stretching. An important point here too is that you do not need to belong to a gym to get fit. You can exercise at home and this can save you time and money. Take a walk around the neighborhood, go for a bike ride. These are all great options to help you. And you may think to yourself, I don't have 30 minutes to fit into my day. My day is already packed. But instead, then maybe try to think of it as 3 10-minute chunks instead. So when you're on your break at work, grab your coworker and go for a lunch. Maybe see how many flights of stairs you can climb. Maybe while you're watching TV in the evening, do some sit ups or some other strength training exercises. One amazing thing about exercise is that even if you start out tired, you will almost always finish with more energy than you started with. So try it out and see for yourself. Next time you're feeling a little sluggish, just take a brisk walk and around the block, see how you feel. I think you'll feel pretty good. So, quitting smoking is going to be one of the best things that anybody can do to improve their health. And that's because smoking is a leading cause of preventable death in the United States. It leads to disease, disability, and harms almost every organ in the body. Unfor- the good thing is that people who smoke, they can quit and they do quit for good. And so even though it's not easy, there are a lot of resources and treatments out there to help you quit. So please talk to your doctor about this. Getting healthy sleep is one thing that I'm sure almost everybody on this meeting can benefit from. And most people know how important sleep is for health. And the reason for that is that poor sleep has real impacts and can cause poor heart health, depression, cognitive decline, just to name a few. And most adults will need 7 to 9 hours of sleep each night. Adequate sleep promotes healing and improves brain function and reduces the risk for chronic diseases. You may have heard of the term sleep hygiene. It's a very good concept. Basically what it is that you're cleaning up your sleep habits. One important thing is to get into a routine. So wake up and go to bed around the same time every day. Use the bedroom for sleeping and intimacy only. Avoid doing other tasks in the bedroom like working. And this helps to train your brain to know that when you're in that room, it's time to sleep. Dim the lights, set the thermostat to a comfortable temperature, turn off your electronics. Yes, if you can even remove them from the bedroom, that's even better. And then avoid caffeine past noon. Another thing is stress. So, quality and amount of sleep is impacted by stress, and it does go both ways. Poor sleep can also cause stress. Sometimes people are stressed for so long, they stop noticing it. And so here are some clues that your body is feeling these effects. You may feel like your temper is short, you're clenching your jaw, you're grinding your teeth, you have muscle tension, trouble sleeping, like we talked about, you're off your diet, maybe you're smoking more, drinking more. And so, for those reasons, it's so important to reduce your stress. Although you may not be able to change what is causing your stress, you can reduce the effects of that stress on your body. Exercise, like we talked about, meditation, deep breathing, prayer, whatever brings you joy and happiness. Walk your dog, go to the park, hang out with your kids, ride your motorcycle, whatever it is. Schedule at least 15 minutes a day for one of these stress busting activities. Next, we'll move on to the health factors that are important when you think about heart health. And so the first one is cholesterol. Cholesterol, just to explain it, is a fat like waxy substance that helps your body make cell membranes, hormones, and vitamin D. So clearly, it's important, it's essential for life. The cholesterol, though, in your blood, it comes from two main sources: the foods you eat from animal products, and then your liver. Your liver will actually make all the cholesterol that your body needs. On the slide here, there's two main types of cholesterol that we'll talk about, and that's LDL and then HDL. LDL is known as the bad kind of cholesterol, and high amounts of LDL can lead to heart disease and stroke. The lower, the better. So when you think about the LDL, the lower, the better. Cholesterol can join in with other substances and it forms these plaques. And that is what makes your arteries less flexible, more stiff, and it reduces blood flow. And this is a condition called atherosclerosis. High density lipoprotein, or HDL, is the good kind of cholesterol. We want this one to be higher if we can. So H for high. It carries the LDL away from the arteries and back to the liver where your body can break it down. And this is why we want the HDL to be higher. High levels of HDL are especially protective in women as well. There is another type of cholesterol, it's called triglycerides, and this is a type of fat in the body, and its job is to store excess fat from your diet. However, over time, or having very high levels of triglycerides increases the risk for pancreatitis. And so this is why we don't want to have high levels of triglycerides. It is very important to have your cholesterol tested. Most of our patients will have their cholesterol tested at least annually, if not every 6 months. Good news is it's very easy to do. It's low cost, covered by most insurance. But the main thing here is that reaching your cholesterol goal is important, but it doesn't always tell the whole story. And that's really because the long-term goal is to prevent heart disease. And there's many factors at play here rather than just your cholesterol. So you may see that your cholesterol values are normal. However, certain medical conditions or family history can increase your risk for heart disease, and thus you may need to reach even lower values than what would otherwise be considered normal for most people. And your doctor here can give you a tailored recommendation. High levels of sugar in the blood can damage your organs, your brain, eyes, and nerves. And if you develop diabetes, diabetes also doubles the risk of heart disease. Doubles it. That's a big risk factor there. This highlights how important it is to know your levels and how to monitor them regularly. But where does that excess sugar in the blood come from? It comes from the food that you eat. So the carbohydrates and sugar in what we eat turn into glucose in the stomach and in the digestive system. The glucose will then enter the bloodstream. In a normal state, your body will take the glucose from the blood and bring down the sugar level because of the hormone called insulin, which is made by your pancreas. In type 2 diabetes, the body cannot use this insulin efficiently or effectively, and eventually the pancreas will lose the ability to even produce it. Diabetes is also largely preventable, but if you already have it, it is important to keep it under good control and keep your body and heart healthy. What is high blood pressure? It's also called hypertension. This occurs when the force of the blood flowing through your vessels is consistently too high. Most people who have high blood pressure tend to have no symptoms, and that is why it's called the silent killer. Optimal blood pressure is below 120 over 80. However, once you've been diagnosed with high blood pressure, the goal for most people is to be below 130 over 80. Most people will have their blood pressure checked at their annual doctor appointments. Once a year, though, it may not be enough to truly know your blood pressure. Thankfully, we are here in a position today to talk about digital medicine, which gives people a convenient and easy way to keep track of their health. So I'll go ahead now and turn it back over to Katie.
Thank you, Aya. That's a wonderful segue. As Aya had mentioned before, having high blood pressure, diabetes, high cholesterol can increase the risk of heart disease, but there are things that we can do to help prevent heart disease. So our digital medicine program is a program that's provided by Ochsner that can really come alongside you to not only monitor your health and support you from a clinical management perspective by clinicians like Aya, but we can also work to support those modifiable lifestyle factors that we talked about earlier. So this is a program that you can participate in from home just by using your compatible smartphone or tablet. And I will share a little bit more about those details now. Okay, so we support high blood pressure, type 2 diabetes, high cholesterol, and weight. Patients are provided a blood pressure cuff or glucometer that pairs with your smartphone or tablet. And then you also utilize the digital medicine app to submit readings to your care team. So if you're receiving care for high blood pressure or type 2 diabetes, you'll be using a glucometer to provide blood sugar readings and a blood pressure cuff for blood pressure readings. We also have licensed clinicians on the team that will work with you. So they will be monitoring those readings, will have the ability to intervene if anything is trending off of track, and can make adjustments to your medication to make sure that you're on the right treatment and dose for you. And then also we support from a lifestyle standpoint. So as a patient in the program, you'll have access to a panel of professional health coaches that can help you work on a specific goal and help you with those modifiable lifestyle factors like we talked about today, like exercise, nutrition, sleep, those sort of things. And we've really seen some excellent results with this program, which we'll dive into a little more into detail in the coming slides. So as I mentioned before, you'll use a digital device to submit readings using your smartphone or tablet. We have a wonderful digital medicine app that you'll not only use to track your project progress, but you'll get real-time alerts for, if a reading is high or low, and you'll get some guidance there. There's also wonderful educational resources inside of the app that also help complement what we do with our professional health coaches. So the clinicians like Aya, like I said, they have the ability to monitor your readings. We can make those medication adjustments. And then we also are supporting that lifestyle component to build healthy habits that are going to help slow that progression of heart disease for patients that have hypertension, high blood pressure, and high cholesterol. And we've seen some really fantastic results. Typically within about 6 months, patients that have been enrolled in the program will achieve their blood pressure or diabetes goals in about 6 months. And we've also seen a reduction in ER visits and hospital stays. So as I mentioned before, everyone in the program has access to a care team. So the licensed clinicians, we have either doctorate level clinical pharmacists that have went through additional ambulatory patient care residency training, and also physician assistants. So those are the clinicians that are going to be monitoring your readings and can do any of that medication intervention. And then we also have our professional health coaches. These health coaches have diverse backgrounds in different allied health fields, and they also have some really awesome motivational interview training, and we'll work one-on-one with patients as they need them, as you have access to a panel of those coaches. All of our communication happens virtually. So over the phone, through the Ochsner app as you're communicating through messaging. So it's not something that has to be, face-to-face or in person, and it really kind of meets you where you're at when it's most convenient for you. We also have a support team. So when we think about, a digital program and using technology and Bluetooth enabled devices, we have a dedicated team there to support you every step of the way. So from the time that you sign up for the program to receiving your device, submitting your readings, getting set up with the app, we have a team that can help answer those questions and provide technical support. Really, the beautiful thing is too, with our app, everything happens kind of in a step-by-step on-screen guide. So it's really simple, and we've had some really great response from patients. But if you do need that additional support, we do have a team that can get on the phone with you and help you and guide you. And then we can also even schedule a tech support appointment at a time that's convenient for you. If you don't want to just call in real time, you can actually schedule those appointments as needed. And all of this takes place over the phone. So I love talking about our clinical outcomes. Our program has demonstrated that our patients do achieve their blood pressure and their A1C goals within about 6 months of enrollment. We see about 80% of our patients achieve that after 6 months. We're also keeping patients healthier, less sick. We're seeing reductions in hospital admissions, reductions in ER visits among patients that are in the program. So patients that are receiving high blood pressure care, we have about 45% reduction in going to the ER, 38% reduction in going to the hospital. And then those that have type 2 diabetes, we're seeing about a 30% reduction in ER visits and a 15% reduction in hospital admissions. So keeping patients feeling better, healthier, and out of the hospital, and really achieving that control, which is so important in slowing the progression or even the prevention of heart disease. So love talking about our member experience. Patients come into the program, they stay in the program, they love the program. We love get to hear all the wonderful stories from our patients. This is a patient named Archie. He is a member in the program. And this quote is, "Digital medicine was there for me when I needed them to help me out, to get me started, and continue that progression to a healthier lifestyle." So just one of many members that have had a really wonderful experience in their health journey through being in this program. All right, so we are going to conclude there and we're going to go into a Q&A, but I do want to put this on the screen. If what you heard today is if digital medicine is something that you feel like you would like to participate in or benefit from, we would certainly love to help you and support you and work with you. You can scan the QR code. It will take you to a sign-up portal where you can not only learn more about the program, but take the first steps in signing up and getting started. So with that, we'll leave that up on the screen. Said ochsner.org/EMHeart, that will take you there, or you can scan the QR. But we will get into some Q&A now. So let's go ahead and take a look. All right. We have a question about, are blood pressure readings different for different age groups?
So yes and no, I will say. So I think you mean as far as the target blood pressure of what we're hoping to achieve. So as you age, as you may know, you may be at an increased risk for having complications from medications. You may be at higher risk of having side effects, having things like falls as well. And so all of that does take into account how strict we are and reduce strict and aggressive in terms of reducing blood pressure. When you're younger and very healthy, we do want to make sure that you can achieve a lower blood pressure because it's actually a linear relationship. The lower your blood pressure is, the better your long-term outcomes are going to be. Of course, we balance that with not being too low as well. However, as you age, depending on your overall health status, how frail somebody may be, the risk for falls, we may not be as strict in terms of achieving that low blood pressure threshold. And so, in some of the elderly patients, depending on those factors, which is a shared decision that comes from speaking with the patient, also looping in their primary care doctor as well as their other specialists, then we may target not as low of a blood pressure goal. So, for example, we may target 140 over 90 in some of those types of patients. But that's a very good question and something that you should definitely talk about with your doctor to know what's right for you.
Thanks, Saya. We have a question about avocados. Are avocados bad for you if you have high cholesterol?
Great question. I love this question. Avocados. I love avocados, okay? I think they have a lot of really good healthy fats. And that's why things like fish, salmon are also very healthy for you because they have those healthy omega fats. So, not all fat is bad. It's really saturated fats that's found in red meats that is more unhealthy for you. And those are the types of fats that you would like to reduce. Butter as well, more so like I would say, yeah, mainly the red meat type of fat, but fats that you get from healthy foods like avocados, fish, very good for you, can actually help lower your cholesterol.
Thank you, Aya. Another question about the program being free of charge. And so digital medicine, it is a covered service under many employer benefits and health insurance plans. Some of those may be subject to applicable patient responsibility amounts. So I'd recommend if you want to scan the QR and go to our sign up portal, we can provide further details about more details about your coverage and what you can expect if you are joining the program. But like I said, it is a covered service under many employer and benefits and health insurance plans. Okay, another question about stress. I have someone that asked about programs that can help relieve stress, or maybe I know you talked a little bit about stress earlier, maybe if there's some certain things that someone could work on or resources related to stress.
Yeah, and our health coaches on our team are also a great resource to talk about these sorts of things too. Just wanted to plug them because they're so good to help with those non-medication things you can do to improve your health. But I mean, stress is definitely important. I've talked to patients about also just deep breathing that can help to reduce stress in the moment. But really, exercise, getting good sleep, those are the main things that come to mind about reducing stress. Again, unfortunately, a lot of things can stress out all of us, and we can't always control that. But recognizing what is stressing you out and then doing some building that into your day to find time to reduce your stress, whatever that may be, is going to be beneficial for you long term. So I think it is a little bit of a trial and error thing, but if it is a long term thing that's really affecting you and your daily life, also talking to your primary care doctor is important as well.
Perfect. There is a question here, and I do want to caveat, any questions related specifically to your personal health, we, encourage you to please consult your healthcare provider for any questions related to your personal health. But just in general, there was a question about what an arrhythmia is. And I don't know, is that something that we could answer? Or would you want
Yeah.
to? Okay.
Just generally, an arrhythmia is your heart not beating in the correct way. So either it's beating irregularly, maybe it's too fast, or the rhythm is not correct. Um, Heart arrhythmias do play into heart health as well. However, it's not something that we directly manage in digital medicine. That doesn't preclude you from joining our program. Your clinician would be able to work with you and manage your medications appropriately. But without getting into too much detail, that's essentially what an arrhythmia is. And so that's also very important to get treated. And a cardiologist is usually the one managing that.
Thank you, Aya. So yes, please, like I said, we encourage you anything related to your personal health, please consult with your healthcare provider. Excellent. I have a question. When someone, is enrolling in the program and, they're receiving care for maybe type 2 diabetes or high blood pressure, how does that, how is the patient's primary care physician kind of informed of their progress, or how do you kind of work with their provider as well as someone is in the program?
Yeah, that's a great question. So a lot of the times we're working with the primary care physicians, they're also referring patients to us so that they know that their patients are in the program. They want them to be in the program. And so we have that open line of communication with the doctor if we need to. But those physicians have really trusted us to utilize our skills and training to make the best decision for the patient in terms of treating their high blood pressure, cholesterol, diabetes. We do limit what we treat to those specific conditions within a certain guideline parameter. And so within reason, essentially, you can also order blood work and such. But anytime where your clinician feels like they need to directly involve the physician into the care more directly, we do that. Even if your doctor is not someone that is directly in our system, if we feel like we have to make that phone call or send a fax of different information about your health, we will do our best to make sure that we're looping in your specialists and primary care doctors so that they're aware of what's going on, because that is really going to lead to the best outcomes for you as a patient. And so, but really, your clinician is specifically trained, to treat your blood pressure, diabetes, and cholesterol. And so, we just ask that you form that trust with the person who's working with you, and they'll work with you as well and loop you into the decision so that you feel a part of your own care. But as best as we can, too, we involve the primary care doctors and we communicate when things become more complex.
Excellent. Thank you, Aya. All right. Well, I think we've completed all of the questions. But I would like to thank everyone for taking the time today. This is American Heart Month, and it's an important time for us to bring awareness to heart disease and the things that you can do proactively for yourself to help protect your own heart. So enjoyed our conversation today. So glad to be here with you all. Be on the lookout. You will receive an email with a link to the webinar recording. So we encourage you to use that as a resource or kind of listen in if there's something you want to dig into a little bit more. But once again, thank you all for being here, and I hope you have a really great rest of your day. Thanks, everyone.